In this video, I'm going to explain you about the drugs which will act on nervous system. See, nervous system is a very complex system, probably one of the most complex system in the body. So first, we will divide the nervous system. We will classify the nervous system. Then we will look the drugs which will act on different parts, different locations and different parts of the nervous system. Okay, so nervous system it is classified into broadly, or we can say broadly into two types. One is central nervous system and another one is peripheral nervous system. Central nervous system, it is subdivided into brain and spinal cord. Brain and spinal cord. And PNS, peripheral nervous system, it is further divided into autonomic nervous system and somatic nervous system. And autonomic nervous system, it is further subdivided into parasympathetic nervous system and sympathetic nervous system. So this is a brief classification of the nervous system. Okay, so nervous system is classified into central nervous system and peripheral nervous system. Central nervous system, it consists of brain and spinal cord. Brain and spinal cord. Okay, and the peripheral nervous system is a nervous system which connects the rest of the body to the brain. Okay, and it consists of autonomic nervous system, and autonomic nervous system, it is subdivided into parasympathetic nervous system. It's also called cholinergic nervous system. Okay, and this nervous system, it works during rest. Okay, so it's also called a rest and digest. Okay, and this sympathetic nervous system, it's also called adrenergic nervous system, and it works when the body is in the active form or when there is some case of some emergencies. For example, someone see the lion. Okay, someone sees the lion. At that time, the body is in the state of emergency. At that time, this nervous system will activate, sympathetic nervous system. So that's why it's also called a flight and fright. Flight and fright responses. Okay, so at that time, the body, the man is in the emergency state. The man needs more energy. The man needs to avoid some, man, he will not urinate at that time. Okay, so at that time, all these systems, they are going to inhibit, and the energy is going to increase. So that is carried by this nervous system, that's sympathetic nervous system. So that's why it's also called flight and fright. Yes. And then we have somatic nervous system. See, somatic nervous system, it's a nervous system which carries messages from the sensory organ to the brain, and then the brain sends back the messages via motor neurons to the effector. Okay, so at this system, local anesthetic drugs will work. See, here in the central nervous system, there are lot of drugs which will act on the central nervous system. For example, antipsychotic drugs, antidepressant drugs, anti-manic drugs, anti-anxiety drugs, anti-epileptic drugs, a lot of drugs. Okay, and that we will see in the coming videos. And this In the somatic nervous system, local anesthetics will work, and here the general anesthesia will take part here. Okay. And now autonomic nervous system, we have that's peripheral nervous system and parasympathetic nervous system and sympathetic nervous system. First, we will see the drugs which will act in this part of the nervous system, that is parasympathetic nervous system or cholinergic nervous system. Here the neurotransmitter is acetylcholine, that's why it's called cholinergic nervous system. And here the neurotransmitter is noradrenaline, that's why it's called adrenergic nervous system. See, in this I'm not going to explain you in detail about the pharmacology now. For now I'm only giving the classification of drugs, that is the pharmacological classification as well as the chemical classification, just classification. After completion of classification of all the drugs which will act on the different organ system, different parts of the body, then after completion of this I will start inshallah the pharmacology in detail. Okay, see, the pharmacology, it's very, it's a vast subject, broad subject. So in order to understand the pharmacology, first you should have the concept about anatomy. Okay, anatomy, it should be brief, but the physiology, you should know very well physiology, and also pathology. And see, what is pharmacology actually? See, pharmacology, it's a link between pathology and physiology. We will give the drug in order to modify a pathological state to a normal physiological state. That's why we should know about the normal physiology. What is the normal physiology, and how the normal physiology deviates into a pathological state, and then how the drug, it will work and tends to modify the pathological state back into the normal physiological state. So that we will look inshallah after the completion of the classification of drugs, that we will go into detail. You should subscribe my YouTube channel so that you will get notified whenever I will make videos, informative videos on the pharmacology. Okay, so first I will see the drugs which will act on this nervous system, that is parasympathetic nervous system. See, parasympathetic nervous system. Parasympathetic nervous system. The drugs, there are mainly two categories of drugs which will act on parasympathetic nervous system or cholinergic nervous system. So these two types are, one is cholinergic drugs. Cholinergic drugs, or it is also called cholinomemetics. Cholinomemetics. For example, in some disorders there is a acetylcholine, there is a deficit, acetylcholine is deficit in the body. So at that time we need to give the drugs which will increase or which will reduce the metabolism of acetylcholine in order to increase the concentration of acetylcholine so that it can carry the normal physiological actions. So in that state we have to give the cholinergic drugs which will increase the level of acetylcholine. Okay, for example, I will give the example of some disorders in which we need to give these cholinergic drugs, like Alzheimer's disease. In Alzheimer's disease, there is the breakdown of cholinergic neurons. So whenever there is a breakdown of cholinergic neurons, there will be no synthesis and no release of acetylcholine. So the cholinergic functions, it will be stopped. So at that time we need to give cholinergic drugs. Okay, and another we have that is anticholinergic drugs. Anticholinergic drugs. See, in some disorders there is excess of acetylcholine. There is overstimulation of acetylcholine. At that time, we need to block the receptors on which the acetylcholine act in order to stop the overstimulation of acetylcholine. Okay, or we can say cholinergic nervous system. For example, there are some disorders in which there is excess of cholinergic acetylcholine. There is excess stimulation from the cholinergic nervous system. For example, there are some disorders like parkinsonism. Okay, so in that disorder there is excess of acetylcholine, and there is for example in parkinsonism there is excess of ACH, that's acetylcholine, and dopamine will be dopamine levels it will be reduced. So at that time we need to block the acetylcholine, okay, in order to reduce its overstimulatory functions. Okay, so first we will look at this. See, cholinergic drugs. Here I will write. See, it is very, broad. Pharmacology is very, very broad subject. The broadest subject in the medical science, okay, is pharmacology. And often it's also called the king of the medical subjects, because this is very important. Okay, without medicine you can't treat, okay, patients. So here is cholinergic cholinomimetics. The reference for this is KD Tripathi 8th edition. Okay. So cholinergic mimetics or cholinergic drugs, they are further subdivided into two categories. One is cholinergic agonists. And another one is anticholine esterases. Yes. So cholinergic agonists, these are the drugs which mimic the action of acetylcholine. Okay. So we have in this cholinergic agonist, it is further subdivided into two categories. One is that is choline acetyls. Another one is alkaloids. In choline acetyls we have example acetylcholine itself. Okay, acetylcholine. Then we have methacholine, and then we have corbacol, and then we have bethanecol. Acetylcholine, methacholine, corbacol, and bethanecol. You can remember these drugs by like this. You can B, C. M, mnemonic. Okay, so A for is acetylcholine, B for bethanycol, C for corbicol, and M for methacholine. Okay, like this we can remember these drugs. Okay, then in alkaloids we have examples like muscarine, muscarine, and we have pilocarpine, and we have ericoline. Okay, and then we have anticholine acetyl. See, this choline acetyl is an enzyme which metabolizes the acetylcholine inside the body. So these are the drugs which inhibit the enzyme, that's choline acetyl, in order to increase the increase acetylcholine in the body. Okay, so in this class we have also lot of drugs that we have that's reversible anticholine acetyl. Okay, reversible anticholine acetyl, and we have irreversible anticholine acetyl. Okay, in reversible anticholine acetyl, see, this further subdivided into two types. One is carbamates and non-carbamate. First, if you want to take screenshot of this, you can take the screenshot, because I'm going to rub this, because this is very, there are a lot of drugs I have to write. So please take the screenshot. So second class is anticholine acetyl. Anticholine acetyl. Okay, so these are the drugs which inhibits the enzyme, that is choline acetyl. This is the enzyme which metabolizes the acetylcholine inside the neurons, thereby reducing the concentration of acetylcholine in the receptors. Okay, so these anticholine esterases, they are divided into two categories. One is reversible and another one is irreversible. Reversible, in this class, they are further subdivided into, one is two types of carbamates and non-carbamates. See, this classification, it includes both pharmacological classification as well as chemical classification, because this classification also gives the idea about the chemical nature of the drug. Okay, so this the cholinergic drugs. I'm not going to separate classification about the chemical classification. So this classification, this is, it includes both pharmacological classification as well as chemical classification. So reversible, it includes carbamates and non-carbamates. In carbamates we have example rivastigmine, And we have another example that's called neurotransmission. Neurotransmission. Another example is pyridostigmine. Pyridostigmine. And another example is rivastigmine. Rivastigmine. Okay, so in carbamates we have physostigmine, neostigmine, pyridostigmine, and rivastigmine. In non-carbamates we have examples hydrophonium. We have hydrophonium, we have donepezil, galantamine. Another example is galantamine. See, these drugs, that's the non-carbamate drugs, they are used in Alzheimer's disease, or we can say Alzheimer's disorder. So these are also called Alzheimer. They are used in the Alzheimer's disease. Okay. So these are also called cognitive enhancers drugs. Okay. Another we have this irreversible. We have this irreversible anticholinesterase. We have it's subdivided into two types. Again, one is carbamates and another one is organophosphates. Okay, in carbamates we have example carbyl and propoxyl. Carbyl and propoxyl. These are insecticides actually, and they are not used medically. So clinically they are not used. In organophosphates we have the drug which is clinically used. There are a lot of examples in this class, organophosphates, but they are not used clinically. So the only drug which is used clinically is ecothiopate. Okay, and one of the important points is that, see, these drugs, they work by inhibiting the enzyme that's cholinesterase. So we have reversible and irreversible. Okay, so in case of irreversible, or we can say whenever we need to reverse the inhibition, okay, so we can give the drug that's called cholinesterase reactivator. Cholinesterase, here I will write cholinesterase reactivator. The example is pralidoxime. Okay, chloride. So this is this was classification. Once again, I'm going to recall it very quickly. See, the nervous system is a very complex system, one of the most complex system of the body. So we need to classify the nervous system in order so we can give the drugs appropriately, which will act on different parts, and or we can say in the different neurons or for the benefit of recipient. Okay, so the nervous system, it is divided into two parts. One is central nervous system and peripheral nervous system. Peripheral nervous system is subdivided into autonomic nervous system and somatic nervous system. Then this autonomic nervous system, it is again divided into cholinergic nervous system and adrenergic system. And today we'll look at the drugs which act on cholinergic nervous system. So cholinergic nervous system, the drugs which will act on the parasympathetic or cholinergic nervous system, there are two class. One is which mimics the action of cholinergic nervous system. They are called cholinergic drugs. And another one is which blocks the action of cholinergic nervous system. That's called anticholinergic drugs, or they are also called parasympatholytics. Okay, so today we said the classification of drugs which act on, which are cholinomemetics. Okay, which are cholinergic drugs which mimics the action of cholinergic nervous system. Okay, so the cholinomemetics drugs, they are divided into two classes. One is cholinergic agonists, and another one is anticholine esterases. Okay, anticholine esterases. In cholinergic agonists, it's divided into two parts. One is that's choline esterases, choline esters. Example, we have ABCM, that is acetylcholine, B is bethanyl, and C is carbachol, and M is methacholine. And then we have second class is alkaloids. Example is muscarine, pilocarpine, and aricoline. And another class, that's anticholine esterases. This choline esterase, it is an enzyme which inhibits the metabolism, which increase the metabolism of acetylcholine, thereby decreasing its concentration on the receptor side. Okay, so these drugs, these work by inhibiting the enzyme, thereby the metabolism of acetylcholine, it reduces. So ultimately it will increase the concentration of acetylcholine on the receptors, thereby give the cholinergic actions. Okay, so anticholine esterases, it is divided into two classes. Okay, one is a reversible anticholine esterase, another one is irreversible anticholine esterase. In reversible, we have it's further subdivided into carbamates and non-carbamates. In carbamates, we have example, that is physostigmine, neostigmine, pyridostigmine, rivastigmine. In this class, that's non-carbamates, we have examples as hydrochlorium, donepezil, galantamine, and these drugs, they are used in the Alzheimer's disorder. And another class, that's irreversible, we have is further divided into carbamates and organophosphates. Carbamates, they are usually insecticides, they are not used clinically. The example is carbamide and propoxur. And another one is that's organophosphates. In this class, the only drug which is clinically used is ecothiopate. Remaining the examples which is given in the textbooks, they are not used clinically. Okay, they are insecticides. So the only drug which is used clinically is ecothiopate. Okay, so as thereby these drugs, they work by inhibiting the enzyme. If we need to reactivate that enzyme, there is a drug called pralidoxime, which is the choline esterase reactivator. So it can reactivate the enzyme that's called choline esterase. Okay, so this was the classification of cholinomemic drugs. So in the coming class, we will look at the this anticholinergic drugs. Okay, so students and all the healthcare professionals, okay, so please do subscribe my YouTube channel and read pharmacology. Okay.